Welcome to the Meet the Partner Saving Lives in Partnership with Higher Education. My name is Jeff Bornstein, and I'll be running this Dialogue for Health web forum with my colleague Merlene Tucker. Thank you to our partner for today's event, the National Overdose Prevention Network. Now it's time to meet the moderator of today's event, Dr. Carmen Rita Navarez. Dr. Navarez is the Public Health Institute's Senior Vice President of External Relations and Preventative Medicine, the Director of the Center for Health Leadership in Practice, and Director of Dialogue for Health for the Public Health Institute. She is also the Director of the California Opioid Prevention Network, or COPN, and the National Overdose Prevention Network, NOPN. Carmen, we welcome you to this event.
Thank you so much, Jeff. Appreciate your setting this up for us so nicely. Let's go to the, okay, very good. So let me start by just going through what our learning objectives are for today. We want to go ahead and start with just a real brief introduction of the National Opioid Prevention Network, NOPN, talk about the role of higher education partners in overdose prevention, and explore how to build effective partnerships with higher education. Let me start by just talking for a moment about what NOPN is and how we can support your work. In 2018, our team at Public Health Institute Center for Health Leadership and Practice launched a statewide forum for all coalitions, organizations, and individuals working to combat the opioid crisis in California. Through that work, we've built a successful statewide learning network serving 33 million Californians. Along with our work for the CDC running the National Leadership Academy for the Public's Health, we've now worked with 167 teams in 53 states and US territories. We've learned what it takes to drive local change for complex problems like overdose deaths. The ingredients are strong partnerships, leveraging assets already in the community, working across sectors by bringing everyone to the table, and adopting what works, not reinventing the wheel. We focus on key evidence-based strategies for overdose prevention. You'll see prevent, manage, treat, and stop framework in everything that we do. So we're taking this network nationwide now, help involve a much larger group of people thinking together, learning together, and talking about how to save lives with better partnerships, strategies, and resources for overdose prevention. So why don't we just go on with the introduction to Dr. Smith, and I'd like you to tell us about yourself and the role that you play in the intersection of higher education and addiction.
My name is Dr. Allison Smith. I am a senior program administrator at the Louisiana Board of Regents. And my role there, the biggest part is that I facilitate our statewide prevention coalition for all of our higher education institutions. So although our Board of Regents has oversight of all of our public institutions, we also work with our public institutions along with our 10 private colleges and institutions. Our office started 20 years ago at Louisiana State University, actually. Our office at the time was part of the Robert Wood Johnson Foundation's A Matter of Degree program, where 10 institutions with high rates of binge drinking were chosen to employ environmental strategies to reduce binge drinking. And we were selected from that program due to the 1997 binge drinking and hazing related death of Benjamin Wynn, right outside the gates of LSU's campus in 1997. We began to do environmental strategies such as something at the time that was pretty revolutionary, like LSU Late Night, which saw direct counter programming to substance use prevention. Typically when campuses do prevention activities, they're around between 11 and 2, right in front of the student union on like a Tuesday, Wednesday, Thursday when students are passing by. But what was revolutionary about LSU Late Night at the time is that it was done as direct counter programming to high risk drinking times. So it was programming that ran from 8 p.m. to 2 a.m. So Thursday, Friday, Saturday nights, the student union would be open with arcade, pizza, free food, those kind of activities, slip and slides, all of those kind of crazy things to directly counter program for high risk drinking times. That was one of the strategies that was employed. LSU was funded through both cycles of that particular grant funding. before switching their focus. And once that funding was exhausted, the Louisiana Office of Department of Health, the Office of Behavioral Health, decided if you keep doing these activities, we'll continue to fund you, because part of the second iteration of funding from Robert Wood Johnson Foundation was to create a statewide coalition to manage a coalition of other campuses that were looking to employ environmental strategies. And so our work has continued on from that time. In 2017, LSU found itself in a very similar situation with the binge drinking and hazing related death of Maxwell Gruber. And at the time, our governor, John Bell Edwards, he decided that he wanted to know everything that all of our campuses were doing for substance use prevention on the campuses. Then we kind of had this glaring omission that, wait, there's a office on LSU's campus that are working with all of our campuses across the state, and that we realized as the State Board of Regents that oversees higher education, we had no clue this office existed. And so we were like rediscovered for like the fifth time, right? That happens to a lot of us, our work gets rediscovered. And so the decision was made to move our office to the Board of Regents to have a broader influence and impact on the policy work and the prevention programming for our colleges. So not much change with our day-to-day activities, so as research and evaluation, professional development, and technical assistance, which is all free of charge to all of our campuses through the Department of Health. But we got to the policy arena, which we've never been in before, which has been awesome for the impact that it's had for our campuses. And so I'll share a little, I'll go move on to the next question, Carmen. I'll share a little bit about how I got involved in this work. I like to call it a very happy accident that I had no clue this particular work existed. How I initially got involved, to start with my office, I've been in my office since I've been a graduate assistant. And it kind of just spiraled out from an internship that I did, an internship with the Center for Substance Abuse Prevention, CSAP, at the Substance Abuse and Mental Health Services Administration, or SAMHSA. And when I got the call for the internship at SAMHSA, I thought I was being pranked, and I asked them to hold on while I Googled to see if they were a real agency, because it was weird setup how I got that. But I kind of got interested in the work, being able to spend that summer working with the folks at CSAP, being able to go into community like Druid Heights in Baltimore, and being able to look how that the world of prevention can play out from day to day, and that it literally opened my eyes to a field I never thought possible. And so I applied for the internship from my office. I got it, and something really funny happened when I got the internship. The associate director at the time that hired me went on maternity leave and never came back. And so when I got there, it was myself, a 20-hour graduate assistant, and a part-time consultant who had come out of retirement to help the office continue its work. And so again, just being responsive and evolving with the needs of our campuses. Every semester, I do a needs assessment with all of our campuses, and it's nothing super duper formal. And I think they've learned to appreciate that over the years. It's usually a very short, I keep it 10 questions or less. What do you need from me? How can I be of assistance? What can I do to make your job easier to serve the students that you serve? And so again, we began to see things come up with opioid use on some of our campuses. And then by us moving to the Board of Regents, the conversation, the people at the table of the conversations I'm having has shifted dramatically. And so it went from me talking to some of our, we have a liaison at every campus. It went from me talking to them, that's some of our campus middle managers, our health, wellness, and counseling center folks, to the presidents of all four of our public education systems, telling our Commission of Higher Education, I think this is an issue that we should look at. And the secretary for the Louisiana Department of Health telling our commissioner, I think this is something we can partner on. Those conversations became very different, that kind of thrust our office into the policy arena, which has been great because we've had fantastic support from the Department of Health as well as the Board of Regents.
So I think this is a really exciting story. And I wonder if you could sort of do a little bit of a pivot and help us to understand more about some of the key challenges or pushbacks that you've seen in higher education when partnering around overdose prevention, and what are some of the strategies that you think made that work?
Very initially, the stigma attached to addiction. Substance misuse, there was a lot of stigma conversation I had to have on one, just even language, the language that we use to describe people who have a substance use disorder, counteracting some of that language, because that was the initial thing. And then dispelling the myth that we were inviting drug use on our campuses. that was one of the things from multiple arenas that I saw, that if we put naloxone on our campuses, that would just tell students, okay, if you have an overdose, we have something here to help. So dispelling that particular myth that no, that's not what we're saying. I was like, and one of the analogies I use is that it's no different than us having condoms in a bowl in the women's center. How controversial that was for campuses of back when that first started happening, but it's very common now. If you go in multiple women's centers or gender equity centers on our campuses, there's condoms there, but that was extremely controversial when that first started happening. And so it's like, it's there in case of an emergency of things are being used. One of the things that was very good in kind of helping counteract that, one is explaining the language around addiction and then making it personal for people who are very hesitant about it, understanding that addiction has no specific person, that it affects us all either directly or indirectly. And then explaining that our students in higher education were part of Louisiana Department of Health, their overall prevention plan for the state of Louisiana, that we're not some special population that's tucked off to the side, some one-off, but that we are part of the state's overall goals. So even though they're college students, yes, they're our students, but they're also citizens of the state of Louisiana. They're our residents here. And so the same way we're aiming to keep them safe, if they're out on the weekend at a shopping center or a grocery store, that it's no different being on our campuses. And that why would we not do everything in our power? Or we're talking about promoting the overall health and wellness of our students. Why would we not do something that's only beneficial, that has no downsides?
Right, right. Really good approach. I'm wondering, how has COVID changed any of this, and how are you finding that you have to do things a little bit differently in the situation of social isolation and distance?
Yes, so it has definitely changed. Last year, I was actually supposed to spend the summer doing trainings about our particular policy. Our policy, our Board of Regents opioid education, training, and reporting policy was passed in June of last year. I was then supposed to spend the entire summer training all of our campuses, going around by systems, by campuses, doing training for campus staffs, doing train the trainers so they can continue to train their staff on the campuses, but COVID happened. And so in even years, we do what we call regional trainings, where we go to our 9 major metropolitan areas across the state. And I had already begun to preview the policy that was coming forward. So we were only able to do 5 cities before we had to stop. So I had already begun talking about, we utilize Generation RX, which again, we're not a one-off. So everybody else in the Department of Health, all of their other subcontractors also utilize Generation RX for their different populations. They have toolkits that are segmented by population, including a university toolkit that is specifically targeted towards college students. And so we had done Generation RX training. We provide them with manuals, but that ultimately led to me creating a 31-minute and 43-second video of myself doing training and being able to, and I can drop the link to before we leave the chat, that all of our resources, that our campuses, it's available on our YouTube and on our website, but our campuses were given the video file so that they can upload it to the learning management system. That way they could assign it to the appropriate staff and student personnel, and then that way they can check compliance. So same way we have to take sexual misconduct or ethics training annually, the video is in a file that they can do that as well. So we also want to be able to ensure compliance as well. But we have regional behavioral health offices that are called local governing entities, LGEs, and that is where our campuses go to their regional office to get their naloxone for their campus. And so we have a partnership with not just the Louisiana Department of Health overall, but also their regional offices as well, that our campuses are able to go there and get their naloxone for their campuses. We provide the training, which covers everything that's required by the law. So even though until we're able to resume in-person trainings, which will probably be this summer, they're able to still satisfy the requirements of everything that they need to do. We provide them with the tools for education, for training, and we provide them with the forms for reporting as well.
Yeah, thank you. So I wanted to say one thing. There was a comment from the audience, and I want to just underscore that it really is important to face stigma just straight on. And
Yeah.
Thank you for bringing that up. Another question from the audience is just how many university staff are you trained to use naloxone, and does that spread across different parts of the staff? Are you able to get to the security staff, to the police department, to the food service workers, people who maybe you might not think of as encountering somebody with an overdose?
So we set forth certain categories of personnel in the policy. And so we work with representatives from all 4 of our public systems and the president of our private association. And so there are certain categories, they're allowed to go beyond the categories, but we had certain minimum categories. So that it's all campus law enforcement, anyone that works in a campus health, wellness or counseling staff, any athletic trainers, any on-campus pharmacies, any live on or live in resident staff, and any RAs have to be trained as well. Anyone that lives in Greek housing has to be trained. And there have to be kids as well in residence halls and in Greek housing. And then anyone who lives in any collegiate recovery residences also have to be trained. And so one of the things that kind of came up was, so again, we worked in conjunction with our system reps to come up with the policy. But one of the things that came up is, what if we have somebody who refuses to administer, that they just feel like there's liability, they don't want to do that. So even in our training, we cover the amnesty laws, the Good Samaritan laws that we have for Louisiana. But the compromise we settled on for that is that if someone does not feel comfortable or confident, they do not have to administer naloxone, but they are required to call emergency medical services. But they have to be trained. Not wanting to administer does not absolve someone from having to be trained, because we would hate for someone to be in a situation and say, I never would do that, I never would do that. And then they're faced with that situation and say, if I had known, I would have done it. And so there is the space for you to say, I've been trained, but I just don't feel comfortable. You still need to call emergency medical services, but you must still be trained.
That's excellent. I'm wondering if you can talk a little bit about whether there's any variation between different parts of the state and adopting these policies.
So the way it works is our Board of Regents oversees all 33 of our public institutions. They have no choice. That is the good thing about our move, I will say that. So it is a policy adopted by our Board of Regents. They have to comply. Our private institutions are able to opt into our policy. So they get free naloxone from us. They have to follow our training requirements and our reporting requirements. And we have 2 reporting requirements. The way our reporting requirements work is anytime there's a naloxone administration on campus, they have to notify their management board within 72 hours. And there's a one-page form that they have to fill out within 72 hours. But each quarter, they have to report to our office if they've had any administrations. Even if it's 0, we still need the paper saying that it was 0. So that way we can keep track. One, it helps us to know the demographics of where we're seeing any trends, and also where we need to replace kits. If there are any kits that have been used, things of that sort, we're able to replace those kits as well.
And do you think that there's a wide understanding, sort of the knowledge of how many lives that you're saving doing this?
Yes, Louisiana, we have a unique situation with the opioid crisis. Our state was one of the states, our attorney general is one of the leading attorney generals on the big lawsuit against Big Pharma for that. And then understanding, I believe it was 1.5 years ago, 2 years ago, we were the #1 state for the most amount of children that ended up in foster care due to opioid overdoses, which is a really, really weird statistic to say out loud, but it is uniquely felt here in our state. And so I'm helping them understand, and I know you said that we see any like kind of differences in the state. We do see some regional differences. For Southern Louisiana, it's very different from Northern Louisiana, extremely different. A lot of people call North Louisiana, myself included, like East Texas, South Arkansas. It's very different from the southern part of our state, where you have New Orleans, you have Baton Rouge, you have Lafayette, the Hammond area. It's very different. But so just for as capacity, we have some campuses that were very, very hesitant about having to have naloxone on their campuses, to us having campuses that were asking, could they acquire fentanyl testing strips? So that is the spectrum of campuses that we have.
And I'm wondering if you could just share for a minute any of the partnerships or any story about a partnership that you think is particularly successful, and why you think that's been successful and why it's critical.
Yes, I think our partnership with the Louisiana Department of Health, the Office of Behavioral Health, has been phenomenal. So as a young master's student starting as a graduate assistant, I also said that I would not want to ever work on a grant, because I had heard horror stories about grant work. I've been working with our office for over 10 years, and I would not trade anything for the world. They have been instrumental. And so before our office moved from LSU to the Board of Regents, there was no relationship with the Board of Regents when it came to prevention in our colleges. They have been an extremely welcome player in helping galvanize the gelling of the political aspect of our work with the practical programmatic work on our campuses. Because our Board of Regents, it is a policy board created by our state's constitution to create policy. And so there was a political aspect to our particular job for as policy that was never an indicator for us ever going forward. And the Board of Regents, the Department of Health has been phenomenal with talking to health legislators on our health and education committees, helping them explain that we included higher education because they are important to our state and things of that sort. And it was vital because initially, before we came up with our policy, we had 4 different lawmakers that were interested in doing a policy, all individual, all completely separate. They all kind of had pieces and things that they wanted to do. We were having a conversation from the Board of Regents, our legislative team, saying, we would love to take the lead on this. If you let us all, we have a unit here now that kind of works with that thing. But it wasn't really until our Department of Health stepped in and said, no, we funded this office to do this kind of work. Let them have a go at this. If you all are not pleased with what they come up with, we can talk about another way, but I guarantee if you give them a shot, they'll nail it. And so we were able to create a comprehensive policy that was also funded, that was completely funded for all of our campuses. There is no cost. They don't pay for naloxone. They don't pay for training materials. Everything is completely funded through the what we get from the Louisiana Department of Health.
Yeah, that's a remarkable story. I really appreciate hearing this and also appreciating the kind of sort of, in a sense, kind of the different cultures that you work with in Louisiana and how each campus of your very large set of campuses need to face this in a somewhat different way. So you really have to do some tailoring, but bringing that all into alignment is super important. Policy at the top matters. And what we know from our work on the ground is that every community has to apply it based on what their realities are. But the policy absolutely matters. So that just sort of leans over to a question from the audience. We have about a minute here. How do you use the demographics or the trends data in order to build your initiatives or policy development?
When we utilize core alcohol and drug survey, we offer that free every 2 years to any campus that wants to take it. And then we also utilize the quantitative data we get from our stores, the reports. What are we seeing in conduct cases? What are we seeing in local law enforcement reports? But we use that to help paint a complete picture and also just asking the campuses what they need. We have campuses that need very different things. And so in part of our technical assistance, we brought in a speaker to do smoking cessation 2 years before our state went smoke-free for campuses. So that was something their local coalition was working on before that. But no other campus needed that at the time. So you'll get a lot of just asking campuses out of what they need.
Okay, very good. Well, there are people in the audience who are asking for your materials, and we will make absolutely certain that we make the link to those available on the website after we post the recording of this tape. So I really want to thank you for this. I think you've done you're doing some amazing work in Louisiana, and hopefully that'll serve as an example to other people and maybe an inspiration about how to organize around this. We've come to time, and I just want to remind everybody that our upcoming webinar in the Colliding Crisis series is Saving Lives by Addressing Historical Trauma. So we hope that people will get to join us for that and continue to join us on this Meet the Partner series, because we're having some great conversations with people, learning about how they are facing the problem of overdose and how to prevent it. So thank you so much, Dr. Smith. We really appreciate you having you in this conversation.
No problem. Thank you all for having me.
Yeah, thank you. Okay, goodbye, everybody, and thanks for joining us.
So.